And tonight, CBS News investigates the shadowy invasion of low-quality medical masks into America's supply chain. Federal agents are cracking down on the sale of shoddy protective gear that's making its way to our frontline workers and putting their lives at risk. Here's CBS's Holly Williams.
In Massachusetts, first responders discovered last month that some of the masks they were relying on, supposed to filter out 95% of small airborne particles, were likely doing nothing of the sort. MIT testing revealed that some masks distributed by the state were filtering less than 30%.
Do you think that some firefighters in Massachusetts may have been infected because of these substandard masks?
I can't say that for sure. I can tell you that our firefighters have been infected. We made the advisory that these KN95 masks should only be used in a worst case scenario.
N95 masks, technically respirators, are needed to protect healthcare and emergency workers. They're strictly regulated by the US government, but there aren't enough of them. So last month, the FDA approved the use of the Chinese equivalent, KN95 masks, providing their manufacturers met certain criteria. But the Centers for Disease Control has warned of counterfeit masks coming from China.
KN95 on it, right?
We contacted several Chinese suppliers posing as importers. Some told us their respirators, labelled KN95, were not suitable for use in hospitals.
I don't suggest you use that.
If someone is telling me don't use this in certain environments, that would raise concern.
Professor Joseph Allen says the US government should have ramped up American production much earlier.
We now see counterfeit masks coming on the market, and that's because there's not a coordinated response and coordinated oversight coming from the federal government.
The Chinese government says it's now cracking down, seizing 89 million shoddy masks. What we don't know is how many of them have already made their way to the US. Holly Williams, CBS News.